Today, we're jumping into a really critical issue, the massive exodus of doctors, nurses, and other healthcare professionals from Africa. And to really understand the scale of what's happening, let's start with a number that's, well, it's pretty staggering.
Every single year, an estimated 23,000 skilled health professionals pack their bags and leave the continent. And just to be clear, that's not a one-time thing. That's a constant, annual drain of absolutely essential, life-saving talent.
And look, this isn't just some abstract statistic. As one researcher, Ruben Pillay, put it so starkly way back in 2007, this constant loss threatens the very fabric of society. He said it causes health, social, and economic systems to literally disintegrate. So yeah, we're talking about a crisis with incredibly deep and devastating consequences.
So, to really get a handle on this, we need to look at the sheer scale of this exodus. Let's see how this crisis is actually playing out in different countries all across the continent.
And you'll see, this is not a problem that's just in one or two countries. Not at all. I mean, take Ghana, where a shocking 75% of new doctors are gone within 10 years. Or look at Zambia. They'd managed to keep only 50 of the 600 doctors they trained over a 21-year period. It gets even crazier. In Guinea-Bissau, there are now more doctors practicing in Portugal than in their own country. This is happening everywhere.
So that leads to the big question, right? Why? Why is this happening? Let's take a closer look at the powerful forces that are driving thousands of these skilled professionals away from the very places they're needed most.
It's really a two-sided coin. On one side, you've got what are called push factors, the things that are literally pushing people out. We're talking low pay, brutal workloads, few opportunities to advance, and just a basic lack of resources. But then, on the other side, you've got powerful pull factors from developed nations, the promise of much higher salaries, better working conditions, and a better quality of life for their families. It's this combination that creates such a powerful current.
But, it's not just about being pushed and pulled. There are also forces that keep people right where they are. Researchers call these stick factors. Things like deep family ties, patriotism, or even just the high cost of moving can make people stay put. And then once someone does leave, a whole new set of stay factors kick in. New friendships, their kids are happy in new schools, all things that make it really, really hard to even consider moving back home.
So, with all these complex forces swirling around, what's the actual direct impact on Africa's healthcare systems? Well, the picture, as you're about to see, is pretty sobering.
This chart just lays the imbalance bare. On average, Africa has just 1.4 skilled health professionals for every 1,000 people. Now compare that to Europe, which has 10.3. That is a massive 7-fold difference in the number of people available to provide care. And the scary part is, this gap just keeps getting wider.
And what does that imbalance actually look like on the ground? Well, it means that countries like Ethiopia and Zambia have lost fully half of all their doctors.
It means that in Mali, 57% of community health posts have had to close their doors. Why? There's simply no one left to run them.
And in a relatively wealthy country like South Africa, 1 out of every 3 doctor positions in the public health system is empty, vacant.
And this all creates a devastating, vicious cycle. The few professionals who do stay behind are stretched to the absolute limit. This leads to burnout, which leads to longer wait times for patients, and ultimately a decline in the quality of care for everybody. The whole system just starts to buckle under the strain.
But the impact doesn't just stop at the hospital or clinic door. Oh no. This brain drain sends shockwaves all across society, affecting everything from how new doctors are trained to the entire economy.
See, when senior doctors and top researchers leave, they take decades of experience with them. That cripples the ability to train the next generation. Universities see a drop in high-level academics. The continent's share of global scientific research shrinks, and the focus of research can even shift away from the diseases that are most affecting local populations. It's a huge loss of intellectual capital.
And then there's the economic cost, which is just mind-blowing. Look at this number. The loss of doctors from South Africa alone between 1989 and 1997 represented a lost investment in their training of $5 billion. That's money spent educating professionals who then take those valuable skills and all their economic potential somewhere else.
Now, to be fair, the economic picture is a little complex. The drains are obvious and severe.
You've got that lost training investment, lost productivity from a less healthy workforce, and the high cost of hiring foreign staff to fill gaps. On the other hand, there are some potential gains. Migrants do send money home, and some might eventually return with new skills, something people call brain circulation. But honestly, most of the evidence suggests these gains rarely, if ever, make up for the massive losses.
Okay, so, faced with such a huge and damaging problem, what on earth can be done? Well, the path forward isn't simple. It's going to require a serious, coordinated effort from both the countries losing their talent and the countries who are gaining it.
There's no single magic bullet here. It has to be an integrated strategy. It all starts at home, of course, by tackling those push factors. Better pay, better working conditions. But it also requires the wealthy recipient countries to act ethically and manage their recruitment practices responsibly. At the same time, you've got to bolster local training, invest in homegrown research, and find ways to lessen the economic damage, maybe even through things like compensation for those lost educational investments.
And really, this all boils down to one fundamental question, doesn't it? The free movement of skilled professionals, that's a reality of our globalized world. But when that movement systematically strips the regions that need those skills the very most, it forces us to ask a really tough question. Is quality healthcare a fundamental human right for everyone on the planet, or is it a resource that just naturally flows to the wealthiest parts of the world? Definitely something to think about.